Welcome to today's Global Connections program. I'm Bill Miller. What is the Batey Relief Alliance? What is the Alliance doing to provide services to people in Peru, Haiti, and the Dominican Republic in the areas of education as well as in health? We'll be back in just a moment to talk about these and other important issues. Welcome back to our program. Today we're taking a look at a very unique organization called the Batey Relief Alliance and what the Alliance is doing in three really important countries in the Caribbean and South America. My guest today is an expert on the Alliance. My guest today is Mr. Ulrick Gaillard. Mr. Gaillard has a JD degree and he is the founder and CEO of the Batey Relief Alliance. Ulrick Gaillard pursued leadership studies at Harvard's JFK School of Government, and he held honorary adjunct assistant professorship at the University of Indiana. Ulrick Gaillard received the prestigious Rotary International's Paul Harris Award for his work in the Bateys in the Dominican Republic, and he is the president of the Dominican Lions Club in Santo Domingo. Ulrick Gaillard, welcome to today's Global Connections program.
Thank you for having me.
I appreciate you being with me today. We're going to get into your program in just a moment, but let's talk a little bit about Haiti in general. We remember January 12th, 2010, the horrific 7.0 earthquake that hit Haiti, primarily Port-au-Prince, the capital of Haiti. We saw that it was immense devastation that took place in that area. There's something like 1.2 million people were dispossessed, 250,000 people lost their lives, 80% of Haiti, of Port-au-Prince was destroyed. In general terms, how is Haiti progressing now? I know there have been a lot of United Nations assistance, non-governmental organizations, but generally speaking, are they starting to bounce back from the rubble or clear the rubble and to get their lives back on track?
Well, yes. Haiti actually, as you remember, in 2010 went through a very difficult time after the earthquake hit. The country was already poor, and as a result of the consequences of the disaster, the level of poverty has increased. I was in Haiti last week on important meetings with the international partners, and I saw myself the progress that is being made by the government to address the basic needs of the population. There's a lot of work to be done because the country's infrastructures are were very destroyed, and the economy of the country also is very challenged. So far, the international community has been with the Haitian government to provide assistance as much as it can. There are steps being taken by the government and to provide schooling, education, healthcare, electricity, housing to the people. But looking at the reality of the country, the devastation that was left after the earthquake, it will take Haiti many more years to stabilize itself.
Exactly. Tell me about the Haiti of today that you're seeing, especially the resiliency of the Haitian people. Haiti has had such a tragic history, but such a rich culture. It's just a remarkably rich culture, wonderful people, but you've got 10 million people in the country of Haiti, which is on the island of Hispaniola with the Dominican Republic. Haiti has about 27,000 square kilometers, 10,000 square miles, an area about 1/4 the size of the state of Kentucky. It's tremendously overpopulated in an area. But talk about the resiliency of the Haitian people.
Well, actually, Haiti, the Haitian people, actually, it's a population that as you said, that is very resilient. It has gone through many difficulties in its existence since the independence to now. It has gone through several political turmoils, earthquakes, storms, and so forth, but still managed to stay on its 2 feet and try to fight to stay alive. What it needs basically is more investment in very serious projects, school, bridges, water systems. Before you can talk about progress in Haiti, you have to have established all these things first. I know the country is focusing a lot on tourism right now, but without having those basic infrastructures, it will be very difficult for the industry to flourish.
Exactly. Now you've got on your Batey Relief Alliance pin, a very beautiful pin. Let's talk about the Batey Relief Alliance. Tell me a little bit about when it was formed, why was it formed, but first off, what is a batey?
A batey is a Taino-Indian term used a few hundred years back when sugarcane was introduced on the island. And today, the Dominican Republic still uses that term to characterize a village attached to sugarcane plantations where the Haitian used to come decades ago to cut canes and then return to Haiti. We call the Batey Relief Alliance because it was an issue that was very important to us to address, where you have more than 500,000 people living in more than 230 bateys around the country without access to basic necessities, school, sanitation, water, employment, and medical care. So for us, when we use the term batey, we wanted to symbolize also the importance of this issue and address it.
And if our viewers would like, they can go to bateyrelief.org, BATEYRELIEF.org.
Indeed.
And learn much more about your programs and also make a contribution if they would like.
Indeed.
Exactly right. How many bateys, now the bateys are in the Dominican Republic where you have the sugarcane fields primarily. How many sugarcane operations do you have and how many bateys and how many people are we talking about?
Normally there are around 230 bateys in the Dominican Republic. They are mainly state-owned and they are also privately owned bateys also by the international corporations that produce sugar in San Pedro de Macorís, La Romana. And you also have some production by the state in Barahona. The population runs between 200,000 to close to 1 million, but we do not know the specifics. We do not know the exact number, but it's in the hundreds of thousands.
Exactly. Now, one of the programs you had listed on your website was the P&G Children's Drinking Water. Is that Procter & Gamble, the company? Is that who your partner is on this drinking water program? And what exactly is that?
Yes, Procter & Gamble and the Batey Relief Alliance are members of the Clinton Global Initiatives. We started a conversation a few months ago about providing clean water to the Batey population. The Dominican Republic has a very serious water problem. The percentage of the people that have access to clean drinking water in the Dominican Republic is very low. And when you're talking about the rural area, and mainly the bateys, the situation is even worse. So therefore, for us, addressing clean water for the population also is addressing health. We had conducted a survey. We found out 14% of the patients that we serve do suffer from waterborne diseases. So for us, it is important to ensure that they have clean water so that way we can reduce the level of healthcare cost for these poor people.
Now, you mentioned the Clinton Global Initiative. What exactly is, we read a lot about the Clinton Global Initiative. What is it and how do you interact with it? How are you a member of it?
Well, the Clinton Global I'm no expert to speak about the initiative, but it is a initiative created by President Clinton and that gather world leaders in non-profit corporation, government to address serious issues that affect populations around the world. And BRA became a member because we were invited by the Clinton Global Initiative to join. It is a very good network for us because we are able to showcase our work. We're able to create new partnerships, such as the one with P&G. So therefore, that initiative actually is a very good platform to address serious issues.
Do you find, as you you've been involved in this relief work for many years now. You're an expert in it. Do you find that more and more businesses are really becoming more cognizant of the problems, that they're more willing to be involved, to work, to help really to raise people up, to help improve their standard of living, their quality of life, because they're looking beyond not just the bottom line, how to make money and that type of thing, but it's in their best interest too to create new markets to help people prosper to a large degree, maybe move into a middle socioeconomic income level?
There's some participation of the, we have seen a level of the public-private partnership, but I think it needs to happen more. The example of Procter & Gamble with the Batey Relief Alliance is a good example, and I hope other companies, other corporations would follow suit and do the same thing, because realistically, the NGO community, the nonprofit community actually is not a rich one. It lacks the resources to do the good work that it needs to do. So when you have a partnership with the private sector and also the government, I think that marriage would produce a much greater result than if you were to do it alone.
Exactly. Now, I mentioned in the opening that you received the prestigious Paul Harris Award, and full disclosure, I'm a Rotarian, so I know a little bit about Paul Harris,
Sure.
not much, but you have 1.2 million Rotarians around the world, 34,000 clubs in over 200 countries and territories around the world. What exactly was this Paul Harris Award, and why did you receive it?
I received the award a couple of years ago as a result of the work I've been doing in the Bateys. I graduated from law school in Rhode Island in 1996, and right after that I traveled to the Dominican Republic to research the issue and try to understand what was going on. And since then I dedicated my entire life into doing this work. So as a member of the Rotary Club of New York, the president and the fellow members thought it was the right thing to do to give me this award.
Well, you're watching Global Connections Television, which is an independently produced program. The opinions expressed on Global Connections are solely those of the moderator and his guest. Today we're taking a look at the Batey Relief Alliance, which is a very important non-governmental organization providing educational and health services to many people in Haiti, the Dominican Republic, and Peru. My guest today is the founder and CEO of the Batey Relief Alliance, and he is bringing us up to date on this very, very important project that we really need to learn much more about. But Ulrick, we've been talking about the Batey Relief Alliance and the programs that you're conducting. One other that I found very interesting is the Vitamin Angels program. What exactly is the Vitamin? It's a very catchy title. What is the Vitamin Angels program?
Well, it is a organization called Vitamin Angels out of Santa Barbara, California. We've been working with. They help us design and implement our maternal child health program, which we are implementing in the Dominican Republic and Peru, and we are now thinking of expanding into Haiti. In the Dominican Republic, for example, we provide multivitamins, micronutrients, and antiparasitic medicines to 62,000 children and 15,000 pregnant women and lactating women. And in Peru, we provide the same to 2,000 children and 450 pregnant women. It is a very important program because it helps address the nutrient needs of the most vulnerables, the children and pregnant women. So for the past 7 years, we've been working with the Vitamin Angels in the Republic, and we hope to continue that partnership.
Exactly. Now, how do you evaluate the success of your programs? Can you see tangible differences that are taking place? You can see marked improvements. I know obviously the poverty is unbelievable in these bateys across the board, generally speaking. They're very, very poor. The sugarcane cutters do not earn very much money per day and very hard work on top of it. But how do you follow the success and see that a difference is being made in their lives to improve their lives?
Well, for us, it's more important than it's not simply to create projects. It's to create an environment where people can come and improve their lives. We are in the business of transforming lives practically. When a family comes to our community center in Monte Plata, they have access to complete medical services, HIV/AIDS treatment, access to agricultural cooperative where they can produce their own crop and produce animals, pigs, goats, rabbits, so they can eat. And also they have access to education, and they have access to microcredit to start their own businesses. Just to think 17 years ago, you go to the Bateys and you didn't find that modern medical facility. People didn't have access to medical services at all. So with a simple infection, a child can have a high fever and eventually die if it doesn't treated rapidly. Now they have the services inside the community. They don't have to go out and be fearful of discrimination or stigma. Right in the community, they have access to all those services. And in the end, we have seen actually families starting their own businesses. They are healthier children. They are pregnant women who are very healthy. The children are being delivered with normal weight, and infant mortality has reduced. So for us, it is a success. For us, it's the kind of thing that we want to see throughout the whole country, and also in Haiti and Peru. Our intervention is a model, one that has been replicated many places in the Dominican Republic. Again, the focus is not to create projects, but it's to transform lives.
Exactly, achieve results.
That's absolutely
exactly,
correct.
exactly.
Mm-hmm.
That's very important. Now, who are some of your other partners? Do you team up with the United Nations agencies?
Mm-hmm.
I mentioned Rotary International, Lions, obviously. You're president of the Lions Club
Sure.
in Santo Domingo. I'm sure they're a partner. Who are some of your key partners?
Well, we call them strategic partners. For example, we have the Clinton Global Initiative, USAID, USDA, UNHCR, and right now
High Commissioner for Refugees.
Absolutely correct. And now we have Procter & Gamble. These are partners to transform those lives that we're talking about. And we also have other partners that we work with to distribute food under a USAID program that we have throughout the Dominican Republic. But the main partners that we talk about are the ones that I just mentioned, and those are the ones that we have been working with for the past 15 years to sustain the organization and then to also maintain the program that we have.
Now, you also reach out to people outside of those three countries, especially in the New York City area, to part of the diaspora. You have a large Dominican population in New York City. There's a large Haitian population and maybe a Peruvian. I'm not too sure, but I do know the first two.
Sure.
But what types of services or what types of initiatives do you have with the folks in this diaspora, and how do you get them involved? Because they play a critical role in helping to improve the living conditions for people in their home countries or native countries.
Absolutely correct. Well, health is especially HIV/AIDS in New York City is a very serious problem. Recent studies and statistics have shown that Flatbush, the neighborhood of Flatbush in Brooklyn, is a place where the virus has been thriving. So what we have done is to partner with the New York State Department of Health AIDS Institute to address this issue. We have used the airwaves actually to educate thousands of immigrants who are poor, who are ill-educated, and do not know how to access the system here. So we teach them about the virus and how to protect themselves, and we also provide them referrals assistance on how to go to certain places for treatment and counseling.
That is extremely important, and it shows that there are problems and there are challenges, not only in Haiti, but also in the United States.
Absolutely correct.
And not only with the Haitian population or the Dominican, but with many other groups in this country too, so we have to keep focusing on this, and that is very, very important. What do you see as some of the major challenges to your program? I'm sure funding is always a problem, but are there any others, obstacles perhaps that you're dealing with? I know no program is ever perfect. You can't, it's never a smooth highway forever, but what are some of the challenges you're encountering?
I would say, since most of our programs are in the Dominican Republic, I would say the main program obstacle that we have is to have more support of the Dominican government. They are one of our main partners in the Dominican Republic. They have been working with us to implement many programs. However, if they were to allow us to enter the country with our medical donations easily, without delays, I think it would make our lives a lot easier. But after that, I think is funding, as you talk about, for any nonprofit organization. Funding is the main obstacle. But so far, I would say those are the two that I can think of as the main obstacles. And of course, if I were to add one more, it would be the participation of the community. If you're going to do any program overseas, unless you have the blessing of the community, you're not going to be able to do anything at all. And we have been very lucky to be able to get the trust of the community where we work. We've been working with them, we've been serving them well, and they do remember that. So whenever we come with a new program or new projects, they do understand it's the Batey Relief Alliance, and they open their arms and their homes to us to serve them.
Mm-hmm. Exactly. I mentioned earlier about the population, 10 million people in the country of Haiti, and basically about 9 or 10 million in the Dominican Republic, but the Dominican Republic is 3 times larger than Haiti is, and you can see it's just a marked delineation when you fly across the border. You see the verdant side of the Dominican Republic, and then you cross into Haiti, and the trees have been denuded, hillsides are running mud and water when it rains and that type of thing. Are you involved in any type of ecological activities with folks? I know you deal with education, you deal with health, you deal with food, but do you work with them on the environment to any degree? This is a critical issue. I know you can't cover the waterfront, but are you involved in any initiatives in that area?
No, we do not have any programs that directly address the environment, but we do have a partnership with a group called the Private Public Alliance that is very involved in this kind of activities. But we hope in the future that we can work with them more closely, to get some activities going on in the Dominican Republic, Haiti, or even Peru. But for now, we don't have any direct programs going on that aspect of things.
Now, you've got a tremendous track record in this area, and you've nurtured these programs along. You mentioned that your program is being emulated. It's a prototype for other folks who can implement it. What have been some of the best practices that you've seen? What have some of the lessons learned that have really strengthened your programs over the years? Maybe something you did 5 years ago that you're not doing today, or vice versa.
Well, I would talk more about our HIV/AIDS prevention and treatment program. We started this program in 2005 with USAID, the Clinton HIV/AIDS initiative, and the Dominican Minister of Health. At the time, it was a very difficult issue to address in the Dominican Republic, because statistics have shown that Haiti and the Dominican Republic combined have 75% of HIV/AIDS rate in the Caribbean, the second largest, greatest after sub-Saharan Africa. So when we wanted to address that issue in the Dominican Republic, it was not well received, especially when we mentioned that we would provide antiretroviral therapy to the people of the Bateys. But eventually the Dominican government understands the need for this and to address it. And now we have a comprehensive system where the person comes in and be tested, and then understand that he or she will come to receive support and to receive therapy, and also to receive complete medical services. And then in the end, they will receive also ARV treatment, which is to complement all the other services that they receive to make them feel better. And after this, this person will have access to our agricultural program and microcredit to start small businesses in the community, to reintegrate them in the community. Because prior to this, they were stigmatized, they were shunned, they were told that they didn't belong to the community. And with our program, we explain to the community, we explain to the government, we explain to our partners, these are people who belong to this community. They have to be treated, they have to be reintegrated. And what we've learned is, after educating the population over and over again about this important aspect of things, they do understand that's what needs to be done. And now you have a complete system that's working for not only the people who suffer from the disease, but also for the family.
Exactly. Do you find that over the years that this whole stigma about AIDS has really changing quite dramatically. That was true in the United States.
Sure.
It was probably true in every country of the world at some point in time, but it seems that today there's more of a discussion, a frank discussion of it. There's more realization that it's not in one particular community. It can happen to just about anybody.
Sure.
And so you need to be aware of this problem. It's a health problem, and you need to work on eliminating it. But do you find that that whole stigma situation is actually diminishing to some degree?
I have to say to you, this is it's a very good point, because I do remember in 2005 when we started to do this work, stigma was a very, very big problem. It still continues to be a problem, but it's not a serious one right now, because after educating the community over and over again about the reality of the disease, that you cannot be infected by just talking to somebody, now they understand it's something that they can deal with. So I have to say to you, it's not completely out of, but it's less than what it used to be. Again, it's based on our experience in the Dominican Republic.
Exactly. Sometimes it takes a little longer to change attitudes.
Absolutely correct.
Very true. Well, very briefly, we're just about out of time, but I know the third goal of the UN Millennium Development Goals is to empower women and to promote equity, gender equity. Do you find that as you empower women that they learn more about what size families they would like, but and that type of thing, very briefly?
Well, you know, BRA actually has a staff of 37 people, and they 90% is women. And we do our program in Haiti about women empowerment, and also we do also a program in the Dominican Republic.
Ulrick, we're just about out of time, but I want to thank you so very much for a very interesting and
Sure.
very informative
It's a pleasure.
program. Thank you. I'm Bill Miller. Thank you for joining us on today's Global Connections program.